So you're going off service as a family medicine resident, and I've been there and I've done that, and I know you're probably very anxious. It's very nerve-wracking, and it's overwhelming, to be honest. And all of a sudden you're being taken out of this cozy, safe clinical environment, and you're being dropped into the literal deep end with inpatient medicine, where you're going to be dealing with patients that neither you or the preceptor know about, have never seen. You probably don't have patient notes on them, and all of a sudden you're dealing with the sickest of the sickest patients. You're worried about code status, and you're worried about running codes. So hopefully this video is for you to help ease your transition into a inpatient rotation. And I just want to preface this video first of all by saying that I'm no expert. I've only done 4 weeks of internal medicine. I've only done 4 weeks of orthopedic surgery, but these are things that helped me regardless. And you're gonna learn so much, and you're gonna realize that you might relate to a lot of the things that I say here once you're done your rotation. But yeah, man, I'm no expert, and these are just things that have helped me, and if they've helped me, I think they can help you. So that's the point of this video. And so regardless of which rotation you're going into, I think it should be helpful, whether it's IM, surgery. I did more medicine stuff on my surgical rotation than I did in my IM rotation. So regardless, hopefully there's a lot of transferable points here that I'm going to make. So let's get into it. So the first one that I want to make is be ready to learn. Obviously this is most cliche point, but it really does matter. When I say be ready to learn, it means have a really good attitude, be someone that's super pleasant to work with. And the way I think about this is, think about someone that you really enjoyed working with. You truly, you had a great time with them, and be that person for your other team members. Have a smile, even in the most tense situation. I'm sure the person that I think about that who is pleasant to work with, even in the most crappy situation, there's someone that I want by my side, and they can make light of a situation. They don't have a problem. They'll help you out when you need them there to be like, they're not gonna leave you hanging. And I think that's really important. It'll help you get along with the nurses. It'll help you get along with your senior fellows, your senior residents, your preceptors. Just be someone that you would want to work with. I think that's the easiest way to put it. And it's different now in inpatient setting. You have to work with the nurses. You might have to work with social work or something. Like, you're going to be working with a lot of different people, and people you've never met before. You're going to be relying on your team a lot more. Inpatient, when you're outpatient, you see the patient in their room separately, and then you go talk to your preceptor in the back room, and you kind of develop a plan by yourself. You figure it out yourself, and then you present your plan of what you want to do. Inpatient is a lot different. I feel like inpatient, you will be asking your co-resident, what do you think here? Or you're not going to be alone. You're going to be talking to a lot of people before coming up with what to do. I know you probably won't implement it, but that patient is going to be talked about by like 5 different people rather than what happens in family medicine clinic. So just be someone that you genuinely look forward to working with every day. And I think that's half the battle, honestly. Just being someone who's ready to learn, who is a sponge in terms of like putting in information, ask for feedback constantly. How's your presentation skill? Is there something you could do better? That makes a genuine difference. And I know that's like, I don't know, I guess it's uncool to be the first point, but anyways. Second point that's more relevant is know your ACLS codes and how to run them. I was part of a code where I was one of the people doing CPR, and we need a good team lead. So for that, I'll share with you some resources and YouTube videos that can help you with that. You never know when you can go into a code status. You gotta know your ACLS codes, or have at least a cheat sheet. Have a cheat sheet for rapid AFib, SVT, symptomatic bradycardia. These are things that will come up in your rotation, and ACLS codes are hard. One of the best resources I found was obviously using the ACL, like the official ACLS documentation, but they have some, quick algorithms and being familiar with that and where to find that. But also there's a YouTuber, Conan. I think he's an IM doc in America. He simplifies the code status, and he very logically puts, gives you step by step as to, how, if you were to run the code, are you comfortable with that? Obviously, you're gonna have your team members around you. Hopefully, you're gonna have, you're gonna be calling your preceptor. They'll be walking you through it over the phone. But that's something that the more familiar that you are with ACLS guidelines, the better off you are. With that, also think about things that can always kill a patient. So you're thinking about MI, stroke, DVT, PE, sepsis, and once in hospital, you will be the first person to see that if something bad goes happen. So you want to make sure that you're not dealing with something that can immediately kill this person. And once you've you don't think that this person will immediately die because of any of those things, then move forward. Next thing I have here is resources. So I used MD on Call. I think it's a $13 app. It was very useful. I don't even know if it's peer reviewed, but to be honest, if you're in a situation like hypertension or something along those lines where you want a quick answer, you have 5 minutes to answer. Once I figure out something on MD on Call and what they recommend, I go on UpToDate. But it's a great spring off, you can spring off of MD on Call very easily. The next resource I have is obviously UpToDate. Bugs and Drugs is great resource. Just used it today while I was on call. It's great. And then Conan's YouTube channel is awesome. I think my top 3 YouTube videos that I recommend off of his channel are pain management. You're gonna get hella calls about pain, man. Everybody's in pain. You're gonna need to know, should I give them Dilaudid? Should I give them, Tylenol, or should I give them? So there's 2 resources for that. Conan's YouTube channel, he has a video on pain management, and then RX Files, there's a chronic pain management chart. It's wonderful, it's beautiful. It goes from Tylenol, and then it goes down to your SNRIs, SSRIs, and then it goes into your combination Tylenol, codeine, T3s and stuff, and then it goes into your morphine quick release, the MR, and then it goes into Dilaudid. So you want to have that gradual progression of pain. People will be in pain, so that's something that you're gonna get called about at 2 a.m. in the morning. And then Conan also has a YouTube video called How to Get Honors in Internal Medicine. As a PGY1, literally your knowledge base is that video. I don't think anybody expects more knowledge from you than what is stated in that video. And what's stated in that video is kind of basic stuff, like how to deal with pneumonia, how to deal with heart failure, how to deal with cirrhosis, how to deal with what else? Heart failure, cirrhosis, but basic bread and butter stuff for IM. He lists in that video, C. diff stuff, what antibiotics to give, when. He gives great breakdowns of pneumonia and stuff like that. So I think, top 3 videos, I'd watch those if I were you. The ACLS guidelines, the honors into internal medicine. Regardless of what rotation you're on, you're going to be dealing with internal medicine stuff, and definitely pain management. So those are some of the resources. Yeah, as I mentioned, have a general approach to the things that I mentioned: heart failure, pneumonia, cirrhosis. Know your metabolic alkalosis, hyponatremia, hypernatremia, AFib, pain management. If you have those things down, I think you'll be really well off going into an internal medicine rotation or a surgical rotation where you're managing the wards, because before you consult medicine, guess who's dealing with this person? You are. So, you can't always consult medicine. You gotta know your stuff a little bit, right? My next tip is, if a nurse calls you on call and you can hear it in her voice, she's concerned, she's worried, make sure you can verbally order stuff over the phone. So, what are the basic things that you're gonna do when you have a deteriorating patient? You're gonna be getting their bloods, you're gonna be getting their electrolytes, you're going to be getting a portable chest x-ray. You're probably going to be getting an ECG. If it's respiratory related, maybe an ABG. Those things can be ordered over the phone. And if you think it's a scenario where it's heading to a code, the nurse, you'll hear it in their voice, like her or him, but you'll know. And the nurse probably knows this patient way better than you because they've been dealing with them all day and you've never seen this patient. So when they think that, you know, this patient requires bloods, or they ask you, do you want me to order chest x-ray or something, just agree to it, because honestly, it gives you data points. So let's say you're in Emerge, maybe it's a 10-minute walk from where you are in the hospital. It'll take you at least 5-7 minutes to get to the patient. And that way they've already started doing the initial investigation. So maybe, you know, by the time you get there, within half an hour, you'll have some data points so you can actually help the person that's in need, because you can't really do anything without some data points. Like you can give them a fluid bolus or something, but like unless you have unless you figure out what their baseline is, get their vitals, obviously you can call that in over the phone. And while you might be dealing with another patient, and the time it takes you to get from one place to another place on floor 7, like it makes a huge difference if you can be proactive. That way your preceptor will have data points as well when you give them a call. You will see traumatic shit in the hospital, and that's I don't know what point we're on, but you will see traumatic shit in the hospital. And honestly, you need to take care of yourself and be hyper vigilant in terms of taking care of yourself. Like, it's not a game anymore. You will see people that will die right in front of you. You will be doing CPR. Just have that in mind. And I can't really emphasize this point enough. Take care of your mental health as best as you can. Take a day off if you need to. Like if you see that kind of stuff, debrief, talk to someone, talk to your family, have some kind of a support network, because you need it, man. I had someone pass away in my first day on call. It still takes a toll on me in terms of, like, I still remember that patient. I still remember exactly what happened, and that's gonna live with me for some time. I remember the eyes of all of the patients that I had to pronounce a death on. I remember the face of the person that I was doing CPR on, who unfortunately passed away. This is some real shit. Like, it's literally not a joke. And get the help you need. Debrief, do what you gotta do. I don't know, man, you gotta have some type of way. And I'm just here to tell you that you gotta do something, because I don't know what it might be for you, but you know, you can't pour from an empty glass. And you gotta before you can take care of others, you gotta take care of yourself. And you will see some stuff that you wish you had never seen, and you need to talk to somebody. I don't know who that person is for you, but please keep your mental health in check. It will affect you. Okay, you're done about that point. What's my next point here? Eat well, keep your energy up, get your sleep. Those are all important things. When you have free time, please don't be in a locked room. Like, go out for a walk or something. Like, pick up a hobby. You need something to, be in the game, because otherwise you're not going to be functioning properly. And it's important that you function properly to get through this, right? So my next point is kind of like it's kind of an advanced point, but it helps. Always think about what's keeping your patient in the hospital. So do they need social work? Do they need physiotherapy? Do they need occupational therapy? Like, kind of just be on the lookout for that. And this is a more like PGY2, PGY3 thing, but like, it'd be good if you can kind of already think about that. Like, can they go from IV to PO antibiotics? Like, can they go home? You're probably becoming a GP, right? Like, if you're so far into the video, if you're becoming a GP, like, what is it that the GP, once they discharge, what is it that they need to know? It's helpful. I think it's always helpful. I think it'll make you a stronger resident, and the best residents I saw like kind of had that in mind. They were like, that's kind of PGY2 level, but that's how you need to be moving, right? You need to be moving like your PGY2. Like, tell yourself, what would a PGY2 do in this situation? What would a PGY3 do in this situation? Obviously, you're off service. I guess, you know, some people just kind of slack, but like I feel like, you know, if you want to be your best, if you want to kill it, like that's the way to be. And if you want to kill it, then that's how you got to be thinking, like, you know, how can I help the team? How can I, you know, can we get this patient discharged? Like, do you know well enough about this patient? And then actively try getting them, you know, to that point, and your team will appreciate it. I think every team, you know, the list gets way too long for rounds if you don't have that approach in mind. And you know, hospital is not a place for people to get well, it's to get less sick. So they're still going to be sick when you discharge them. It's just they're not, you know, they're never going to be well in the hospital. It's not a place for people to get well. Learn from everyone, even the med students. Med students saved my butt during my rotations, especially if you're an international medical graduate. Like, med students, they know the ins and outs of the hospital. We had some great, I got so lucky, man, on my team for internal medicine. Like, I had some 4th year medical students, and man, they were, you know, if you're watching this, you know, because they were really, you know, I really appreciate them, and they really helped me out. They have, you know, because they're studying for exams, they're looking for all of these like weird diagnoses. They have a really broad differentials compared to you. Like, you did your exams, you went through CARMs, maybe you haven't studied something in like a year's time now, but they might be in it, and they will have, you know, they have a lot of great input. And you were just a med student like 4 months ago, so, you know, be nice to them, let them go early if they if you can, like if you're on call with them or something. Like, you know, they're great to learn from. What else do I got? Ask for feedback early and often. I think I mentioned that. And then finally is embrace it. If you're gonna be a robot for a month, just take it for what it is. Be a robot for a month. Go in early, leave late. Just embrace it, man. Just when I was in orthopedic surgery, like I just thought of myself as an ortho bro. I was like, what if I didn't go into family medicine and I chose to do orthopedic surgery? Like, how would I be moving? And bruh, like, you just move different when you have that mentality, right? Like, just be an ortho bro. If you're an IM, just be an IM bro. And you know, think of all the weird stuff that, you know, search up pathoma or some UWorld stuff and look at, you know, how's their MCV, you know, do they have thalassemia or something? Like, do they have multiple myeloma? Like, think of these things that are, you know, just embrace it. Just take it for what it is. You're there for only 4 weeks, and probably, you know, like, we're only here in residency for a short period of time, and I think, like, you know, there's only going to be so many internal medicine blocks that you got to do. There's only going to be so much, like, you're at the finish line, and you're never going to be as working in a team like this ever again, unless you do hospitalist or something. But realistically, in GP, like, you're not going to be doing this stuff. So just embrace it. I mean, it's cool. And yeah, I think if you go in with that mentality and you know, really, you're smiling, be that person that smiles at someone at 3 a.m, man. Like, you know, nobody wants to be in the hospital. Nobody wants to be in the hospital. Your preceptor doesn't want to be in the hospital. The nurses don't want to be in the hospital. The patients don't want to be in the hospital. It's going to be, you know, maybe there's a lot of discomfort. You know, it might be too hot. The AC might not be running. Like, elevators might be stuck. But be that person that smiles through it. And, you know, at 3 a.m. when people are just grumpy and stuff, just be the person that's more pleasant. And I think those are the most memorable people that I've worked with. You know, they're always pleasant. And I think if there's anything in this video that you want to take away, it's that. I think that's half your battle. People will forgive you for calling them up in the middle of the night or something, or, you know, bother. If you're pleasant, a lot of people are there to help you. If you're really stuck, like, call up the ICU resident, call up, you know, go to your emerge attending and just be like, hey, I'm a PGY1, I need help with this. There's so much help around, and I think, like, it really pays if you're nice and you're, you know, you're cooperative. So anyways, that's all from me. Best of luck in your rotation. I know, you know, it can be overwhelming, it can be nerve-wracking, it's definitely stressful, but I'm sure you're gonna kill it. And just keep the bread and butter in mind. You only gotta know there's a limit to how much as a PGY1 you're gonna know. So ask for help and you're gonna kill it. Just go through some of the basic stuff like bread and butter, IM or medicine stuff, or whatever is bread and butter in your rotation, and just try your best, and you'll be good. So I'll see you guys in the next video. This one kind of was more rambly, and I just wanted to, a lot of people were asking me about my advice because I had already done some of the hardcore rotations in my residency. So that's my advice, and yeah, best of luck.